week ago, on the 11th, I weighed 127 pounds and 12 ounces. Now we're this past Friday, 122. Found the test results from the CAT scan, and an internal biliary duct drain is present without evidence for intrahepatic biliary ductal dilation. The gallbladder remains distended with thickening and mild irregularity. Soft tissue fullness at the region of the ampulla of Vater that was not noted on the prior study. Correlation with endoscopy findings is recommended. An aortocaval lymph node has increased in size since the prior study. Concerning for malignancy, stable benign appearing lucent lesion in the left iliac bone. Gallbladder biliary cancer staging. Helical axial CAT scan images of the abdomen and pelvis were obtained and displayed at 5 and 1.25 intervals. Automated dose lowering techniques or adjustment according to patient size were utilized. Oral contrast was given. The images were obtained in the arterial venous delayed phases. Comparison from the July 24th lung basis. Linear opacities are present in the bilateral lower lobes, right middle lobe and lingula, which may represent atelectasis or scarring. No pleural effusion. The heart is normal size. Liver, hepatic steatosis, stable subcenter hypodense lesion. Segment 5, the portal vein opacifies normally. The central veins opacify normally. Gallbladder remains dilated. There is a mild asymmetric thickening of the wall of the gallbladder laterally, measuring up to 4 millimeters. Bile ducts again, an external biliary drain is present, terminating the region of the porta hepatis, without evidence for intrahepatic biliary ductal dilation. The common bile duct is unchanged in diameter, measuring up to 0.6 centimeters. Error is noted in the common duct due to instrumentation. Pancreas, no evidence of pancreatic ductal dilation or mass. Spleen normal. Adrenals normal in size, morphally bilaterally. Kidneys and ureters. Left kidney partially duplicated, left renal collecting system. No nephrolysis or hydronephrosis. Right kidney, pelvic right kidney. No nephrolysis or hydronephrosis. Sub-centimeter hypodense lesion in the right renal endopolar is too small to characterize. The kidneys enhanced symmetrically. There is no evidence of hydroutor or ureteric stones in either stomach and bowel. Neural contrast reaches the transverse colon of the splenic flexure. Soft tissue fullness of the region of the ampulla of Vater that was not present. No dilated bile loops or areas of focal bowel wall thickening. The appendix is unremarkable in appearance. Lymph nodes. There is a 1.1 centimeter lymph node on the aortocaval region that has increased in size since the prior study, previous 0.7 centimeters. Bladder, undistended. Reproductive organs, there are no adnexal masses. Uterus is normal. Vessels scattered. Calcification, no aortic aneurysm seen. Peritoneum, free of fluid. abnormal, normal in appearance. The bones are osteopenic, multi-level degenerative changes of the lumbar spine, degenerative changes of the symphysis pubis and bilateral sacroiliac joints. There is stable, benign, appearing large lucent lesion measuring 2.4 by 1.6 may represent a subchondral cyst or bone cyst. Well, I have to be careful how I sit. My tailbone hurts a little. Now this is what the doctor said. The 24 tubes, catheters, and devices partially visualized, traversing left lobe of liver and curled in central bile ducts with decompression, a previously dialed box. Trace atelectasis or scar, bilateral lung, pleural spaces unremarkable. Lymph nodes finding numerous mildly prominent mediastinal lymph nodes felt to be reactive. Large node and AP window measures at 9 millimeters in soda axis. Vasculature unremarkable. No aortic aneurysm. Liver hepatic steatosis is evident. Bones and joints. Congenital fusion of T2-4. Mild scattered degenerative changes of the spine. Soft tissue unremarkable. Numerous mildly prominent mediastinal lymph nodes felt to be reactive. Largest node in AP window 9 millimeters. Partially visualized. I did the blood CBC. White blood cells. It looks okay. Red blood cell 4.6. It's between 401 and 5.3. Hemoglobin is high, but it's 15.6 and the standard's 15.5, so I don't know if that's so bad. Hematocrit, my value is 46, standard range is 36 to 45. They got their flight is high. I mean, some of this is only a teeny bit high, so it can't. This is blood work. Mean cell volume 99.1. Standard range is 80 to 96, so they said that's high. Mean cell hemoglobin, mine is 33.6. Standard range is 27 to 33, so they said that's high. Mean cell HGB, whatever, within range. Red cell, within range. Platelet count 245, standard range is 150 to 400. So all the rest kind of seem. ABS neutrophil 5.2, standard is 1.8 to 7. ABS monocyte minus 0.86. Standard range is 0 to 0.810. They said that's high. Metabolic panel. This bicarbonate low is 21 and the standard range is 22 to 29. Creatine 0.93 milligrams. Standard is 0.50 to 0.90. They have that high. Glucose 228. Standard range is 70 to 140 high. Sodium low 132, standard range is 136 to 145. Hepatic function panel. Bilirubin minus 7.3, standard is less than 1.2, so they have that high. Bilirubin direct is staying high. My value is 3.9, standard range 0.3. Alkaline phosphate, I had a glow in the dark then. My value is 336. Standard range is 35 to 104. High. AST/SGO minus 68 UL. Standard range is 32 UL, so they got that high. Whatever this other one, ALT/SGP. My value is 58. The standard is 33, less than 33. But I'm in range of the protein. Cancer antigen. 19.9 serum. Mine was 483. Standard range was 30, less than 35, so it's high. Rocha. Electroluminescent immunoassay obtained with different tests or kits cannot be interchangeable. CEA, whatever that is. They have that high, 3.6. Standard range is 3.5. That's pretty interesting to find this stuff, but I don't know what a lot of it means. All I know is that middle of my tailbone hurts if I don't take it easy and sit in something more comfortable. Hate my feet, they're ugly. You see, I've lost probably muscle. It's the problem. Because it's hard to eat anything. I gotta be careful brushing my teeth. It can make me have the sensation of barfing. I get tired easy. Tired. And when I realized it, it just seemed like a joke and a hoax and a game on me. And it feels like my health is being used inside others. That's my feline son. Gone now. He died in the bed with me. That I've had enough of it. I've had enough. Talked about if this is a cancer thing. Chemo. It's not 3/4 of the liver, if not a liver transplant. It makes it pretty hard not just to care about other people involved, according to the WAP cop. They didn't care about me. It's always been a game. I can't really read these things anymore without these shitty glasses. It could be the sugar. Could be the stress. I'm sick of this shit, all because some couple little bastards wanted to play a game. That whore had 'em. She had 'em by the curly hairs. She could have sued everybody. But they made sure that she took a hatred on me.